All right, y'all, should we kick it off? Cool, well, maybe let's have a hand for ourselves for coming out on a beautiful Sunday. Thanks, everyone, for coming today. Awesome. So I actually wanted to invite people to stand if you want to and do a song. I mean, from where I come from, we kick it off with some music because we're trying to, this is a movement and movement involves movement. And so folks who are was anyone here at the huge march that happened like a week or two ago from the hospital down? Okay, so we did this at the end. It's kind of a chant march and it's a call and response. But when I say, what do you want? You all say healthcare. Don't say, what do you want? Does that make sense? Okay. It'll make sense when you go. How does it go? Here we go. What do we want right here today? Healthcare. Oh yeah, all right. So we can do a little better. So I'll say, what do we want right here today? And you all say, what do we want right here today? Like that. I'll sing it with you. I think we'll get it, don't worry. What do we want right here today? What do we want right here today? Healthcare for our people. Healthcare for our people. We're marching till we get our way. Marching till we get our way. Healthcare for our people. Healthcare for our people. What do we want? Healthcare. When do we want it? Now. What do we want? Healthcare. When do we want it? Now. All right, I think we got it. What do we want right here today? Let's get some clapping. Right here today. Fair contract at the hospital. Fair contract at the hospital. We're marching till we get our way. Marching till we get our way. Fair contract at the hospital. Fair contract at the hospital. What do we want? Fair contract. When do we want it? Now. What do we want? Fair contract. When do we want it? Now. What do we want right here today? What do we want right here today? Safe staffing for our patients. Safe staffing for our patients. We're marching till we get our way. Marching till we get our way. Safe staffing for our patients. Safe staffing for our patients. What do we want? Safe staffing. When do we want it? Now. What do we want? Safe staffing. When do we want it? Now. Let's do that one more. What do we want? Safe staffing. When do we want it? Now. All right, you all. Thanks, everyone. Cool. Well, thanks so much for coming out today for this town hall. To hear about what's going on at the hospital, what's going on across the lake at CVPH, at the community health centers, up at UVM, and in our K through 12 public schools as it relates to healthcare. We have an awesome set of panelists who are going to be here in person and also live over Zoom. So maybe let's just take a hand to applause for them. We'll hear more about them in 1 second. I also wanted to lift up the organizations that helped make this happen, in particular Vermont Mayday Strong. Let's get a hand for Vermont Mayday Strong. Folks can sign up to get updates, learn more, plug in with Vermont Mayday Strong. There's sign-up sheets over there. And also I wanted to lift up the Burlington Progressive Caucus, if we can get a hand for them as well. And of course, the unions who are represented here. We have leaders with us today from a number of different unions, and we'll hear about those too. And I'm Keith Brunner with the Vermont Workers Center, a community-based organization, live here in the Old North End of Burlington. So we are here to hear what's happening at the hospital primarily, but also in other fronts of struggle around healthcare. And it's a campaign. This is, we are in motion, and so we wanted to start at the top with some of the action steps that people can take to make sure that doesn't get lost. So the first is that you can see there are lawn signs over there. So there's an ask for folks to grab those lawn signs. You can check in with an AFT organizer, but maybe grab a few if you can distribute them in your community. We want to get the word out to stand with the healthcare workers at the hospital in their fight for safe staffing, healthcare for all, and a fair contract. We also want to lift up, there are online petitions, in particular, around bargaining for the common good, and paper as well. So you can see folks over there. Make sure to sign if you haven't signed as well. and we'll hear about what's happening at the community health center. There's an online petition to support the community health center workers as well. So we can get that to you. A third action step in standing up for healthcare, supporting the folks who care for our communities, is to invite union leaders to your community organization, to your union, to your faith congregation or community to share what's happening. Folks are trying to get out in the community to talk about what's happening at the hospital, because we know we're all patients. Even folks who work at the hospital are also patients. This is everyone's fight. And then the last thing is just to re-emphasize Vermont May Day strong. There has been a rhythm of mobilizations on Labor Day and May Day, and in between people's summits and forums. There's a movement on the move here, not just nationally, but also here in Vermont. And so again, sign up there for updates. And so before we kick it off with hearing from our speakers, I just actually want to, is the audio good? Are we good, Charlie, too? Folks can hear us over there? Okay, great. We're doing a bit of a hybrid action. Just a bit on the context. We're coming in at a moment, it's not just in Vermont, but there are cuts to our healthcare and hospital and health center closures around the country. It's maternity wards, it's federally qualified health centers. In Vermont, we haven't had hospital closures, but we've seen the Springfield Hospital Birthing Center close. We saw the health center in Bellows Falls, the community health center, close. There was the fight at Copley around the birthing center right there, the birthing center in Brattleboro. And so, we are dealing with a lot, and that's why it's so inspiring to see people out today and folks who are watching on video. And of course, part of this is political attacks from Washington, D.C., from the Trump administration, cutting people off of Medicaid, creating the conditions for these closures and cuts. But it's also been a bipartisan consensus, a commitment from both parties here in Vermont as well as nationally to a model of healthcare that treats healthcare as a commodity and not as a public good, a public service, like our fire departments, like our public schools. And so a lot of the crises that are breaking out now have their roots in this model of healthcare, which is not about meeting human needs or the needs of the people who are providing care and supporting that. Before we dive in, I did want to say one more word about Brattleboro Memorial Hospital. We were hoping to have a panelist from Brattleboro. Earlier this month, management at Brattleboro, they've been dealing with an over $10 million deficit there, and I think a lot of people were worried that there would be a hospital department closure announced, and they announced plans to close the birthing center there in the next 6 to 9 months. And the folks who work there, there's two unions of nurses, support staff. The midwives are also very organized. They had already seen this coming, set up a website, and they were out in the streets within like 3 days of this announcement on July 4th with hundreds of people saying, hell no, we are not closing the birthing center. People have an emotional, familial connection to this place, and we also know that a birthing center closure can often be the first cut to a hospital that leads down the line to that whole hospital closing down and kind of being dismembered. And so they're picking that fight and making sure that doesn't happen. There's an online petition as well hosted by AFT Vermont to save the birthing center. I would encourage people to check that out, and also Save Birth. I think it's savebmhbirth.org is a website hosted by the midwives there. So I know we're a little bit far away, but I think folks down there see the need to make this a statewide effort. And in particular, this is the last thing I'll say about Brattleboro. People have been focusing on management there and telling them to rescind their plans to cut it. They're also calling on the Scott administration, who can move money to help support our hospitals, and saying we don't want to have a policy of just allowing hospital departments to close left and right. We need to have our government, our state government, proactively stepping in to treat these hospital departments as essential services for our communities. And so there's a big effort. If folks haven't already, folks are calling Governor Scott and saying, keep that birthing center open. We need to move forward together, not one step back on healthcare. And so with that, you know, I'm really excited. I see, hey Matt, we have a ton of folks who are deep in the different fronts of struggle as it pertains to healthcare. And so the first person, maybe I'll just say we have Melissa LaValle and Tegan Cook from UVM Medical Center, Support Staff United. Awesome. We have Jessica Jacobs from Vermont Federation of Nurses and Health Professionals from the bargaining team. That's up at UVM Medical Center as well. We have Chris Swice and Dan Sturrock, potentially Dan might be joining us, from the New York State Nurses Association across the lake in Plattsburgh at Central Vermont, or CVPH over there. We're very excited to have them. We have Lou Rochford, who's the treasurer from Community Health United, our community health centers here, our federally qualified health center. Deirdre Mannion-Fisher from UVM Staff United, the University of Vermont. And then finally we have Matt Guile from the Winooski Education Association and also representing Vermont Mayday Strong. Yeah. So we're going to hear about, again, the hospitals, the community health center, and then how is this impacting our K through 12 public education and higher education as well. And the first folks who are going to kick us off is, I think I'm going to throw it to Melissa. And just for the structure of today, we're going to take about 5 minutes for each speaker to hear what's going on, their connection to the healthcare fight, what their union is doing to fight for healthcare for all and for their members and for quality patient care. After this, we're going to open up for comments, questions, just kind of a rolling discussion with folks in the audience. And then at the end, we'll return to, you know, what are those next steps so we can go on to this is a campaign. This is not just a one-off. This is one moment in a continuity of struggle. So Melissa, I think I'd love to hear from UVM Medical Center Support Staff United, if you could kick us off.
All right, thank you so much, Keith. My name's Melissa LaValle. I use she, her pronouns, and 40 hours a week. I am the financial and administrative assistant for the psychiatry and mental health departments. I've been doing it for 8 years. When I started, it was for UVM Medical Center, where I work. As of this week, it's now Plattsburgh, Central Vermont. Porter folks got folded in, and Elizabethtown, along with CVPH. I am secretary of Support Staff United, as well as vice president of healthcare for AFT Vermont. And we started talking about bargaining. We knew our contracts were expiring within a few months of the technical unit of VFNHP. And I think, as we all know, when we bargain together, we are stronger together. And so we were building blocks for many months, making sure we were all kind of on the same page ideologically. And our bargaining survey went out and showed that folks in both units wanted the same thing. And that primary thing that they wanted was safe staffing. We know this is an incredibly hard economic time all around. Our folks are not immune from that in any way, shape, or form. But hospital workers aren't hospital workers because they want a fat paycheck. They care about the community and care about providing quality care to the community that we're all part of, that our families are part of, that our friends are part of. And so after deciding that bargaining together was going to be the way forward, we decided to fold in, along with the usual economic demands, healthcare, stuff like that, to put in some common good articles. We believe that we have the opportunity now to kind of start a wave, and I think we're seeing that already ripple out to folks that are preparing bargaining coming up soon. Things that we are asking the hospital to be a part of: milk with dignity. Our hospital serves a lot of milk. We would like to know it's coming from farms that treat their workers properly. That is incredibly personal to me. I grew up on a farm, and my parents' biggest and most effective threat to me was that if I did not behave, I was going to have to work on the farm. So that got me this far. But we're also asking that the hospital not use their very expensive lobbyists and publicity department to fight us in our struggle for universal health care for Vermonters. There are folks making six-figure salaries that are doing nothing but being roadblocks for the common good, and it's time to stop. If the hospital's so tight on money, then we can save them a lot on lobbyists and publicists, and we are happy to do so. We took these common good proposals and wrote them up and brought them around to our members. And we are representing about 3,300 folks altogether between techs and support staff. And we got a super majority of sign-on. Our people are behind us. They want us to use our union power, not only to improve our working conditions and make sure we are running a safely staffed hospital that can properly care for its patients, but we also want to improve the community that we are all a part of. And I think we can all kind of see that for-profit healthcare has not worked. We seem to be the only country still laboring under that delusion. But I've been to Holland, I've been to England. They are not shitholes. People are not dying in the streets. And I think we deserve the opportunity to have healthcare as a human right. And that is what we're pushing for.
Thanks so much, Melissa. Yeah, and I feel like I didn't adequately lift up, but the folks who are on this panel and also in this room represent thousands of people who live and work in this state. This isn't just, I mean, people probably have some great opinions here, but people are speaking on behalf of like 3,000 workers, probably many thousands. So I think that's important to just lift up, and that's why organized labor is so important for making change, is because we're moving lots of people. And so I'm excited to hear from Tegan. Yeah, if you could go next, thanks.
Hello, my name is Tegan Cook. I'm the Operations Support Specialist at UVMMC, and that doesn't mean anything to anyone because they have very obfuscating titles there. What that means in my particular role is that I am the lead chemotherapy scheduler for outpatient cancer patients. We have about 54 providers who can prescribe this kind of treatment in our outpatient section of UVMMC. We have 7 schedulers. And that is, frankly, a pretty high scheduler to provider ratio compared to some other places in the hospital. That doesn't mean that those other places aren't also understaffed. But we have a unique level of complexity that has caused our understaffing to become critical to the point where I think that we are on the verge of a sentinel event in our clinic any day. If you're not aware of what a sentinel event is, it is severe patient harm or death due to the hospital, the provider, some kind of mistake happening somewhere, and that mistake is staffing. If you get diagnosed with cancer here, you're going to be sent to the outpatient hematology oncology clinic. What's going to happen is you'll have an initial visit with your provider. They're going to decide what kind of treatment is necessary, whether surgery is necessary. They might send you over to surgical oncology for a consult there. Then you'll come back over to medical oncology and you'll get prescribed treatment. And that sounds like a pretty simple thing to schedule. Unfortunately, a lot of these medications are extremely difficult on the body, which a lot of us know. For example, a lot of these medications are really hard on your veins, which means that in order to give a patient some of these medications, they have to have a PICC line placed, which is a little tube that like comes out here, goes directly into your heart, or a port placed, which little kind of plastic guy right here with a tube that goes directly into your heart, so that we're not doinking your veins by giving you this medication. We have, I think, 3 providers in interventional radiology who can place those ports. We have to get that coordinated with getting an echocardiogram of the patient's heart to make sure that they are physically fit enough to receive this medication without massive side effects. We have to coordinate with our specialty pharmacy to give any oral meds that the patient might need. We have to coordinate with our on-site pharmacist to talk to these patients about the treatment that they are receiving, because there are a lot of really weird side effects and a lot of really weird no-nos. For example, there's one medication that we give where you can't drink anything cold or your nerves kind of stop working. So it's really important that we have all of these things figured out and put together. And that is the kind of thing that we would have to get scheduled out for one visit, for one patient. And we haven't even talked about actually getting the juice in them yet. It's an incredible amount of coordination for each scheduler, for each different provider that they're scheduling for. The medications are different depending on the diagnosis, depending on the provider, depending on whether or not the provider does research studies. And we are also operating with an extraordinarily limited amount of chair space. And those chairs are physical chairs where people have to sit and be under the supervision of a nurse to receive their medications. I am not aware of a single person on my team who has not had some kind of stress-related health issue in the past several months. I was asked by my boss to leave work early on Friday because I was having a stage 2 hypertension episode. People are getting migraines. I have people on my staff who cannot have conversations about what we are going to do when one of our staff members leaves because they get panic attacks immediately. We are not in a position to be able to care for our patients anymore. All of us are terrified all the time that we are one mistake away from getting someone killed, that we don't have the oversight available. My team has not had a practice supervisor for months now. We're struggling desperately, and we are trying so desperately to get management to listen to us. I'm on step 3 in a grievance process to get us more staffing, and the solutions that have been presented to us so far are things such as, you could try working faster. We can't get overtime. We can't get more staff. It takes us about 3 months to train someone due to the level of acuity in our work. And again, I want to say, we are not the worst staffed clinic. We aren't. And the reason why I'm here is because a rising tide lifts all boats. If we can get our milk with dignity, if we can get our common good things, that is incredible. It will do amazing things for all of us. And what's also going to happen is if we don't get safe staffing, if that one load-bearing aspect of our contract is not fulfilled, people are going to die, and it is going to be people you know. It's going to be people who you see every day. It's going to be people who work at the hospital. It's going to be people who work for other healthcare organizations. It's going to be people who work here in City Hall. And that's simply the fact of the matter. We do not have the adequate staffing to sustain human life in our hospital anymore, and that has to change. So that's why I'm here, and I know that that's why a large number of our membership is going so hard on promoting the needs that we have for this contract, because we are afraid for you. We are afraid for ourselves. This is not a simple matter of just like, well, you know, it'd be nice to get another $5 an hour. It's a matter of life and death, genuinely. Sorry to bring down the vibe, but that's my piece.
Thank you. And next up, we're going to hear from Jessica from VFNHP.
Hello. So my name is Jessica Jacobs. I work in the Sleep Center. I started there in 2010, so it's been about 16 years, 15 of which I worked night shift. Oh, sorry. Okay. 15 of which I worked night shift. The last year, I've transitioned to a second shift position, kind of for some health-related things from working night shift. So I've been there a long time. I did have a brief stint at another hospital, but more or less I've been at UVM for that amount of time. And I've seen a lot of changes along the way. So we are definitely experiencing some safe staffing issues, kind of just staffing shortages in general. So what's happening, we have a very high turnover rate with our night staff. It's difficult to recruit new staff. The wages are just not high enough for the cost of living. We do get people who apply from out of state, and you know, once they kind of see what it's going to cost to live in Vermont, doesn't end up panning out. We've actually also started to have to hire staff who we know are not going to be there very long term. It's kind of just a stepping stone position for them. They're going to go on to medical school, which is great, but the training time is very extensive. So it's about 6 months or more, just to kind of get you sort of at baseline. Even after that, you're still learning for many years. You're needing the assistance of your senior staff, which we have very few of at this point. We have 2 senior staff on nights and 3 relatively new people, 2 very new. Most of the time when I started in sleep, we had anywhere between 8 and 10 night techs. We would occasionally hire a traveler, not for very long. We currently now have 2 travelers, and we have a 3rd that's going to be joining us in August. It's the most travelers we've ever had. Part of the issue as well with recruiting new staff or keeping new staff is that the work is just too hard. The patients are sicker, and they're just, we're being asked to do too much. It's too stressful for our senior techs who have kind of, sort of progressed with, the patient population changing. It's a little easier, although it was even challenging for me towards the end of my stint on nights. So for new staff, there's just no reason for them to stay. So what happens when we are short-staffed with our night staff? It prolongs the ability for patients to be seen for their sleep studies. So right now for our in-lab sleep studies, we are booking out to January for adult patients and into February for pediatric patients. The pediatric patients often need to be a 1-to-1 ratio, so it pushes them out a little further. So with a lot of our adult patients, they're what we call a 2-to-1 ratio, so the tech would have 2 patients that night. So what's happening now is because the patients are sicker, those 2 patients you're running, it's very challenging, and the hospital has not kept up with sort of changing those ratios to reflect the patient population we're seeing, which is why it's so challenging for our newer techs. If patients are, having their sleep studies delayed, they're getting their treatment delayed, it puts them at higher risk for heart disease, heart attack, stroke. It puts them at higher risk to be admitted into the hospital on our inpatient floors, and then we're overwhelming that system. I think I talked about the traveling techs. The other challenge with our traveling techs is a lot of them are not up to par for what we're experiencing in our lab. So they can kind of get by, we can get studies run, but we're not getting, the same quality of work. So that's challenging. And we've also not had the hospital really investing in the sleep program for a long time. We operate out of a hotel, which we've been doing since I started. The majority of our sleep studies are in a hotel. It is nice because it's a little more comfortable, but it's not, the best solution. And then where we work at the hospital, the building is very old. It's not really set up well for us. So those are some other challenges. Our equipment is old, it's failing, they're not investing in new equipment. That's taking time for the techs to troubleshoot the equipment, change sensors that are old. It's disruptive to the patient's test, it's disruptive to the patient's sleep. And if anyone has, experienced a sleep condition or not sleeping well, pushing these appointments out further and further and further is, detrimental to people's health, but their everyday ability to function. So, so we're seeing a lot of staffing challenges in the sleep center.
Thanks so much, Melissa, Tegan, and Jessica, just getting a glimpse into, some of the things that are happening at UVM Medical Center and why folks are fighting for themselves, for their patients, for all of us, and the common good. We're going to hear next from Chris with the New York State Nurses Association across the lake at Champlain Valley Physicians Hospital in Plattsburgh. So I'm going to send it to you, Chris, on Zoom.
Great. Everybody hear me okay?
Can you try that one more time?
Can you hear me okay? Yeah. All right. Good afternoon, everybody, and thank you for having us here. Yes, my name is Chris Wise. I'm a registered nurse at CVPH. I've been there for 25 years, and I'm a member of the executive committee as the grievance co-chair. We are here today to send a clear message to the management of UVM Health that the NISMA members at CVPH are in solidarity with the AFT members at UVMC. We are part of the same healthcare system, and we want the same things. A fair contract now. Whether you live and work in New York or in Vermont, we all deserve quality care for our communities and good union jobs. We all need to fight together to save our essential healthcare services. We are all tired of being asked to do more with less. We are sick of having to pay for management short-sightedness and poor planning. Instead of cutting the executive pay, administrative, and overhead costs, UVM Health is cutting frontline staff and services. They are cutting the workers who make our healthcare facilities run. That is not right, and that is totally unacceptable. Our contract at CVPH expired December 31st. We are nearly 900 nurses and healthcare professionals strong. We are demanding safe staffing, fair pay, and staff retention. As of now, we are taking measures to escalate our efforts if management continues to play their games at the table and does not engage in issues that matter most to all of our members. Just as we will not stop fighting for our community, we know that AFT members are just as passionate in the fight for quality health care in Vermont. I know that you are not done fighting. Now that we are with you, know that we are with you in solidarity. When the UVM workers stand united, we will never be defeated. We are with you, and we are in this fight with you. Thank you.
Thanks so much, Chris, for those comments. Next, we're going to hear from Lou from Community Health United, our federally qualified health center for the sort of greater Burlington area. So I'm going to send it over to you, Lou. And also send this to you.
Trying to do this gently. Sorry about the bang. Thank you for having me here. We at Community Health United are grateful to receive an invitation to join you today. To give a little information on who I am, my name is Lou. Some of you actually know me, which is kind of scary. I'm the treasurer of the Community Health United, and until tomorrow, I've been one of the employees impacted by the recent layoffs in the Health Information Management Department, also known as the Medical Record Department if you don't know hospital jargon. Tomorrow I'll be transferring into a new position with community health centers as I took a position as an alternative to layoff. For those who may not be familiar with what's been happening, CHU has spent the past 2 weeks responding to job carts that followed Community Health Center's decision to contract with the third-party billing company Migrant in May of 2025. This is the third round of layoffs in less than 12 months. Management recently clarified that they only count this as the second round in 2026, so I want to be clear, just in case management, gets wind of this, like, third round in 12 months. Management recently clarified this because they only count this as 2 rounds because the first involved per diem employees. And if you've ever worked per diem, you have a job, but you're not guaranteed to keep that job because it's base by base. CHU is still a young union for support staff. Our first contract took effect in 2023, and now we really haven't made a lot of noise. And what has been inspiring is watching our members come together. The billing department, which has borne the brunt of these layoffs, gathered more than 120 signatures on the petition in just 48 hours of this announcement. The last update of the number I've seen was over 150 signatures on a petition. And for a young union, that's remarkable. It tells me our members aren't just fighting for themselves, they're fighting for each other, for their patients, and for the community health centers. We met management because we believe layoffs should be the last option, not the first, and we asked for transparency around the organization's finances, meaningful collaboration to find alternatives to layoffs, an end to spending millions on outsourcing, transparency around the Medusen contract, a CHU appointed seat on the board of directors, and a commitment to advocate alongside us for universal health care in the next legislative session. That meeting produced two important moments. First, our CFO, Patty Gratton, acknowledged that signing the Medusen contract had been a mistake. Second, after we requested the contract, because even the CFO couldn't tell us what it costed monthly, we discovered it contains a clause allowing community health centers to end the agreement after being told we cannot. I think she actually made two mistakes that day. The first mistake saying this was a mistake, and the second mistake was saying, well, if you file an RFI, we'll release the contract. She could have just told us costs. We eventually received a copy of the contract, but with the financial information redacted. And then we were told if a select few union reps wanted to see the unredacted version, we'd have to agree not to share the financial details. You can decide for yourselves what to call that. I can only describe that as an NDA. Yep. And when workers are expected to trust decisions that affect their livelihoods, transparency shouldn't come with conditions of silence. We also asked the board of directors to meet with us and discuss alternatives to layoffs, and as of today, I haven't received a response, or have been told that we have received a response. Before our July 2022 press conference, we reached out to the interim CEO, Dr. Harry Chen, and invited him to sit down with us, and his response was simple. Thanks for reaching out. After consideration of your request, I'm going to respectfully decline. As someone who works in healthcare, reading that felt a little like seeing the epic pop up and say, this action may take a few moments. Healthcare workers know that usually when you see that, we sigh and wonder what fresh chaos is about to unfold. Management later defended these actions as strengthening the organization's financial stability. And as employees relived that reality, one of my coworkers was denied a replacement prosthetic through our new self-insured health plan after theirs broke. And I've spent about a month trying to resolve a billing issue for preventative diabetes care for myself. Healthcare doesn't become stronger because a spreadsheet balances. Healthcare becomes stronger because people show up, and the people who answer the phones, fight with insurance companies, process medical records, schedule appointments, and help patients navigate a healthcare system that is already confusing enough. And this isn't just about layoffs, it's about what kind of healthcare system we want. One built on transparency instead of secrecy, collaboration instead of exclusion, investment in people instead of outsourcing, because when workers lose, patients eventually feel it too.
That's right.
And that's why we are asking this community to stand with CHU, not for our jobs, but for the future of the community health centers, especially in Burlington, when these centers are being closed all over our nation. Thank you.
Thank you so much, Lou. We're next going to hear from Deirdre from UVM Staff United, thinking about higher education, and then we're going to hear from Matt from the Winooski Education Association. You know, these are two unions, K through 12, higher education, thinking about how healthcare is affecting thousands of folks who work in education in our state.
Hi everyone, I'm Deirdre Mannion-Fisher. It's a great honor to be here. I'm here on behalf of UVM Staff United, which is the staff union at University of Vermont, and I'm here on behalf of our leadership team. I am a co-lead steward for UVM Staff United, and my phone got my talking points here, so I'm just gonna keep tapping the screen here. Okay, I work in the Cancer Center. I add an additional layer of complexity to the, I support opening clinical trials. I'm a regulatory specialist. I make IRB submissions. I edit consent forms that tell patients all the risks of the trials, and each unique, different trial has a different care and different needs and different requirements. So that is my job, my day job. And so I work closely with a lot of medical center staff. They're clinical coordinators. They're the ones who see patients. They're the ones who make sure all the data gets collected. We have data coordinators who enter all the data so that patients can be on the cutting edge of care and get the newest trials, and also get the data that we need to be able to have these drugs available on the market. So that's me. I'm also very active in UVM Staff United. I started here about 3 years ago. I became an area steward during my probation without knowing what it was. I just knew I say I didn't know to fear, but now it's okay though. We have each other. But about a year ago, I became co-lead steward. So I'm just basically here showing that we are with you, that we were with you in the contract fight. We know that when you guys get better base wages, you have more step scales. We don't have a step scale. We have parental leave. We have holiday, like different things, but we all have the same needs as workers, and we support each other. So, and we're patients here too. We're participants on clinical trials, and the working experience affects each other. My coworkers are our staff in your union. So, yeah. So basically, we've experienced in UVM Staff United over and over in our bargaining, basically like UVM's goal is to reduce costs by rationing care, so they offer us alternate plans to try to be like, have a high deductible, and the result is people don't seek care basically. And so we're saying no. They refer to in committees on benefits, they call it, oh, there's some frequent flyers, and in bargaining, like as if care is a luxury that we use. So we've heard this over and over in these committees, and then during bargaining last time, that took 11 months, a year, because we still have a law in the books in Vermont that says, this is a Bernie Sanders state, why do we have a law that says public employees do not have the right to strike, and why can't we get this fixed? We love to see you guys preparing for strikes, but we're a little jealous over here when we support you. But yeah, I mean, we're all here because we care about higher education student experience. We care about patient experience. We care about research. That's why we work at UVM. We're not here to, again, make a fat paycheck. We're here because we believe in the work. What am I saying? Yeah, we're neighbors. We're in solidarity with you. We love to see, we kind of share the belief in a fighting democratic union that our power comes from every person being involved, from our one-on-one conversations with each other, to show that we're getting that we're not gonna get what we need by asking nicely. I train our shop stewards. I argue grievances, and we don't win these fights, these asks, by asking nicely. We don't win them by being right. A lot of times we have these employers, right? Like these higher education employers. We believe that our employers should be convinced by the right thing to do, that we know that's not true, you know? So, But yeah, when you guys win a better contract, we can look at it and say, hey, us too, you know? So that's not like, oh, they get this, why can't we get that? You know, that's not a union idea. Like we all get more together. We all deserve what we need.
And we're going to send to our last panelist, which is Matt. Hey, thanks, Keith. Yeah, I'm Matt Guile. I'm the librarian at the Winooski School District, where I get to read stories with preschoolers all the way to 12th graders. And I'm the former president of Winooski Education Association. Currently, I'm the chair of our Political Action Committee. Education workers and healthcare workers are facing the same attacks to impose austerity on our schools and our healthcare facilities, using a real affordability crisis as an excuse, without actually addressing the underlying cause of that crisis. And that's our for-profit healthcare system, our for-profit housing system, that really is extracting value from working people. But education workers and healthcare workers also share similar strength, right? Our work is caring for those in our community. And, that connection is so powerful, right? That's why we say educator working conditions or student learning conditions, and safe staffing saves lives. And that is why it is so important that we're together in solidarity, seeing us all together on this table here right now. And why I'm really excited to talk about this new burgeoning Healthcare as a Human Rights campaign that Vermont NEA and AFT Vermont has just launched. Actually, this is like hot off the presses. Yesterday at the AFL-CIO convention, they committed to also sort of supporting the campaign. And that's really, again, the amazing, unprecedented, astonishing work that Worker Center had done, passing Act 48 in 2011. We really need, if we're going to carry that to implementation, we need a movement. And in this Healthcare as a Human Rights campaign, Vermont NEA and AFT Vermont, we actually have, there's a great synergy there, right? Our strengths support each other's weaknesses. AFT Vermont, most of their members are all in Chittenden County, whereas Vermont NEA has committed members who are trusted in their community in every single legislative district in this state. And education workers aren't always considered authorities on healthcare. And AFT represents people with earned and lived experience that can really speak with authority to our healthcare crisis. And that's why we're always going to be stronger together. And Vermont NEA really has started a commitment to really do some work to get our members engaged in this movement. I think one of the struggles that Vermont NEA is having, and this is the work that we have to do, is educators have actually been pretty insulated from this healthcare crisis. Our healthcare is bargained statewide, so again, our individual bargaining teams don't necessarily see that. But again, that's suppressing our wages. And the largest cost driver of our school budgets is the rising cost of healthcare, right? So I think education workers are starting to see the need for this, and it's our work to really make sure that they're committed and engaged in this fight. And it doesn't matter how good our health insurance is if your local clinic closes, if your birthing centers close, right? That crisis is going to continue to escalate as ACA cuts and the subsidies are falling off. People are going to fall off of Medicaid. That's going to mean people are not getting the type of care, the preventative primary care, that actually addresses and supports people's health. So it's actually going to increase our overall healthcare spending, which is going to send us very predictably and foreseeably off of a cliff. But again, Vermont NEA is showing that it's committed to this. We have coordinated pledge cards that we're going to be rolling out to members over at the beginning of this school year. We're looking at passing school board resolutions because our school board members also do see this crisis. The driving cost of our budgets is the driving cost of healthcare. And we're getting involved in taking on solidarity actions alongside of our healthcare working allies, right? I got to have the opportunity to speak next to Lou at the press conference for the Community Health United. Because this is really going to take a movement. You know, I can't just have a new person elected to the state rep and walk in and say, hey, has anybody ever thought of like universal health care? Right? We need a coordinated statewide movement that is able to sustain that pressure across our state over the long term to make sure that we can carry this to completion. And this Healthcare as a Human Rights campaign really is the fruit of the May Day Strong Coalition, which has been holding May Day, Labor Day rallies where we marched on ICE-dated facilities in solidarity with migrant justice. We've held solidarity schools, making those connections, those cross-union solidarity connections. That's how we're going to build a movement that is able to demand the things that working people need. And again, I'm just so excited that this is getting started and sitting here with all of these amazing people. So thank you.
Awesome. Thanks so much, Matt, for pulling it together. And I just want to re-emphasize something that everyone said, which is in this context of cuts and closures and austerity, folks are not just circling the wagons, but they're going on offense and fighting for everybody. You know, and that is just a powerful statement. So maybe let's have one more hand for our panelists who shared today. Awesome. And so now we have a little bit of time. We're going to take, you know, maybe 25 minutes to open it up and hear from the audience. And so I want to invite people to share. I think I would invite questions for the panelists, or we would invite questions for the panelists. Also, if you have a comment, just kind of keep it brief, just to create space for everyone to get in there. And let's remember that we have Chris on the Zoom. If anyone sees Chris trying to wave and I don't see it, please be like, hey, Chris is trying to get in there. And I know we have a ton of community leaders, union leaders, elected officials in the audience with us today, so I'm really excited for this next section. So I think with that, let's open the floor, and maybe I'll just do a pointing thing. If people could raise your hand and I'll point to you. I don't think we're going to run the mic to you. We'll just try to speak up so everyone can hear. So who wants to kick us off with the first question or comment?
And repeat questions. We will repeat questions when we're answering them as a panel, I think. Yeah.
I think we were just, we covered all our bases.
Don't everyone speak at once.
And one thing I did forget to kind of harp on, which I should have, UVM Medical Center, UVM Health has been ordered by Green Mountain Care Board. They were forced to create an independent liaison board to oversee. And as part of the Vermont 911 Health Coalition, which is Governor Douglas and Chris Pearson and a bunch of other folks, they were told very explicitly to cut from the top. They were told very explicitly to cut from executive pay. They were told very explicitly to cut overhead admin, and that is not what's happening. They are getting rid of folks that were checking you in and out. They were getting rid of nurses at primary care centers, and they've been very loud in public that they cut all of these directors and assistant directors. They consolidated the jobs. My director 5 years ago was director of neurology and psychology, but we have so many more clinics, we have so many more clinicians that they separated it out. They just made her reapply for her old job again. And that's what they've done to the other folks. They've just kind of reconsolidated things and shuffled them around. We got an email saying the chief nursing officer was retiring, Peg Gagney, she's been here forever. They're replacing her with 3 people. They're replacing her with 3 people. And those folks are not making $20 an hour, I can promise you. So we've been in bargaining since April. They waited until 3 months before the contract expired to bring a single economic proposal. And they are not even moving on things that won't cost them a dime, like parking designations, stuff like that. So we are coming in, we're working in good faith. Like we say, we understand the economic hardships of the time. We want to be a collaborative partner, but we just need to really highlight that they are showing their priorities, and their priorities are not safe staffing.
Yeah, I'm Ashley Smith. I'm part of Mayday Strong. I just had a question for Tegan and Melissa, because the public line from the hospital management is they're crying poverty, they got to cut, there's no money in the system, blah, blah, blah. It's hard on the outside to take that seriously when you look at a country stuffed with billionaires and they don't pay taxes. And so that I just wonder how you're responding to that, because a lot of the public is hearing poverty, poverty, poverty on the part of the hospital system. So how are you responding to that? What is management saying in negotiations about that? How are you countering it? And then what's the mood among the rank and file of the medical workers to get ready for a strike? And final thing, what can we do on the outside to help with the struggle?
Thank you so much, Ashley. That was a lot of questions. We're gonna tag team this. They're crying poverty now. That Green Mountain Care Board decision I referenced a couple of minutes ago was because they were making too much profit. It was because they were making too much profit. And so what did they do to reduce their profit? They have artificially reduced the census. They've artificially reduced the number of beds upstairs that they're allowing people to go into. So what that looks like is, let's say your husband has a pituitary adenoma and it's sending him just crazy, just out of his mind. They come in to the emergency department. You hang out for 12 hours. Are you kind of stable enough to get in the car? Yes, you are. Go home. And we played that game 5 different times. So that has been personally really upsetting for me. So they were told to cut profit, and the way they've gone about it is now costing them X, Y, Z dollars a day. It's just hard to know the story that they're telling with numbers, how in touch with reality that is.
I also would love to chime in that the document that was released by the Green Mountain Care Board in regard to like the top 30 executive salaries, I don't remember if that was 24 or 25. Yeah, I think this data is from 2024, but the highest earning person at UVM Medical Center made, including bonuses, $997,000. And I understand that Vermont is a high cost of living state, but I don't think we're quite at that level where that's a reasonable wage for a single human being. And there's also the fact that they're crying poverty. I am treating upwards of 80 patients a day, and keep in mind the nurses' safe staffing ratios for patients cut off at 60 in my clinic. But we're treating about 88 patients a day, and I would say that from the escalation emails I get, most of those meds cost between $37,000 and $142,000 per treatment, and that's just the chemotherapy or immunotherapy. We're not including the nursing time, the supportive medications, none of that. Or we have a CAR T clinic, which is really incredible stem cell therapy for hematological malignancies. Every single one of those treatments is over $1 million. So I am truly and deeply curious as to where this poverty is coming from, because from my point of view, a single one of my patients pays that $1 million salary, so I don't understand where the other 87 patients' drugs worth of money is going. Truly and deeply baffling, and I know it's not going to me because I can barely afford my apartment that doesn't even have closets.
Sounds like maybe a for-profit healthcare system creates warped incentives that don't align with the care that patients need.
No, the system just is not working. And then to speak to the last part of your question, the strike threat, nobody wants to strike. Like I said, we're here working at the hospital because we care about the patients. We want to be there to serve them, but we know that if we aren't standing up now for safe staffing, we're not serving our patients anyways. Yeah.
I think a really important thing that everyone in the community can do to support us in our struggle right now is that if you receive care through UVM Medical Center, I would take it as a personal boon if you could ask to speak to patient advocacy and file as many complaints as you can for any difficulty that you face. If it takes too long to get a response to a question, if you have to ask more than once to have your medications refilled, if you face any issues as a patient, first of all, it is your right to seek patient advocacy, and second of all, those emails are going to fill the inboxes of the people who don't want their inboxes filled, and it will go a long way to proving that these problems are real. Because what management is telling us by bringing back a proposal to disband safe staffing committees, by refusing to increase staffing for my clinic, by refusing to give us overtime despite the fact that we are weeks behind on our work, is that our problems aren't real. That is the message that they are sending. And we need as much support as we can to prove to them that, yes, these problems are real. You're not facing them because you have millions of dollars, but real people are facing these issues.
Right here, and then in the back next. Go for it.
Me?
Yeah.
Very good. We are yet again looking through the never-ending cycle of capitalism, and it's coming for essential services. Yet again, putting further strain on our fragile health system. Our education system is buckling yet again. 5-6 years later since the pandemic, including for healthcare, and it's the consequences of for-profit system that we're living under. My mother was born and raised in the socialist Republic of Yugoslavia. They had universal healthcare back then. They had universal education. If someone wants to go to a university, no problem. It was available for them. If anyone needs healthcare, it was available to them. My late grandmother, who died less than 6 months before I was born, had a history of medical complications and other issues associated with the unhealthy lifestyle she lived, including heavy smoking, and they provided care for her that prevented some serious outcomes, such as the development of peripheral arterial disease. I had other relatives who benefited from access to care, including my mother, who sustained a serious knee injury while skiing down the slopes of the Lashkitsa when an experienced skier crashed into her. Yugoslavia was one of the first nations outside the U.S. and some Western European countries that provided reconstructed knee surgery.
Tito can do it, we can probably figure it out.
Well, and just to lift up, like, it's not rocket science. It doesn't have to be this way.
Rocket science at all.
I feel
My mother used to travel around a good swath of the former Soviet Union, and contrary to the propaganda of SPED, the people there had a modest life over there, certainly. The streets were not paved in gold, and they had their issues, however. They had healthcare, they had housing. The bureaucracy was also an issue that prevented access to the masses, however, it was there. Whereas for here, people had to jump through many hoops. I had to jump through many hoops about a couple of years ago to obtain some needed care for managing a rare disease. And that was delayed and ultimately canceled, and I'm returning to splitting my time out of state for something that the UVM Medical Center can easily treat at an outpatient level.
Yeah, thank you. Yeah, I mean, we can do this. I feel like the injustices abound in healthcare, and we know that we can build a system that's rational and humane. And I wonder if we want to just to hear some more voices. Is that all right if I send it to in the back? We have 2 folks. Yeah, go for it.
I'm Smith. I also serve on the staff medic exec board with Deirdre. Thank you, Deirdre, for running us today. Just honestly, just seeing a little bit of what actually we say about austerity. It's a real frustration on the college and university side of things as well. We've seen record-breaking enrollment and very high enrollment for about the past 5 years until this year. And during that time of really, really high enrollment at the university, we were still told out of our
do you think it's because UVM's so cheap to go to?
Out-of-state students to come and come to school again. Majority of our students are out-of-state students, and even in-state students face relatively high cost of attendance. But even then, you know, we'll turn to them and we'll say, we would love to work with you on funding universal health care in Vermont, because that actually is a really high cost for the University of Vermont as well as for its employees. So we would love to not have them put that on us, and yet, you know, there's still not a lot of movement on that end, even though we do know that would actually be an economic efficiency for the university that would expand the pool of people having access to the same healthcare system. And so, you know, that's something we face multiple times is having that kind of put on our backs, and something that, yeah, we really support alongside sports staff united and VFNHP.
Thank you, Elizabeth.
Thank you. Yeah, and I saw Vivon, and then over here next.
Yeah, I really love hearing universal health care. Very exciting, right? Vermont and Burlington. I feel like we got really close to universal health care in 2011, and then through like extremely insidious public and private mega corporate like engineering, it was jettisoned from the show months. And so I guess what I'm curious about for Vermont and also nice as well, is that like in this current cultural moment where there's kind of an onslaught of like, you know, children in Palestine dying, that being very normalized in the news and us being told that's okay. We walk by in Burlington and we see our house neighbors being given, not forget healthcare, like not human decency care. That's the sort of cultural world that people are experiencing. If you guys have like a wish list of what kind of concurrent struggle needs to be happening that allows you to have an easy time in compact reviews, that gives you an easy time for pushing forward these like common good reforms, what would you do? What would you change about like what else we could be doing to like sort of get us around it? You know?
Like if we have the magic wand, is this the question kind of?
Step one, Winooski voters elect Matt Guile.
I think if you want to answer magic wand or practical, like I would like the Palestine solidarity people to do this, to take down the weapons industry so that money is freed up or whatever, then go for that too, or whatever.
Well, I mean, I think that both answers are kind of the same, right? In that, like, you've put a really great pin on the issue, which is that in both cases, it's the normalization of social murder. The lack of affordable health care, the lack of affordable housing, the lack of social supports that allow people who are facing all kinds of difficulties that would allow them to like fully participate in society in a healthy way, as well as the genocide in Palestine. All of that is the normalization of social murder. We're all being told constantly through all of these tiny things throughout our day that fundamentally some lives are worth less than others, and it's really hammered home in this instance that if you aren't making $1 million, then you can't afford meaningful health care, you can't afford to live in Vermont, you can't afford housing. And what we're fighting for here is that basic respect and dignity that is the building block to getting that like public health care. The first step is to recognize that human beings are human beings and the worth is intrinsic. It's not a matter of, well, you know, I have an MBA and I went to medical school and this means that I am the most qualified person to suck up all of the money in Vermont. It's about realizing that like your education doesn't matter, none of this matters. Human beings have fundamental intrinsic worth. That worth needs to be respected by allowing people to live in the most fundamental way, which is receiving healthcare, having their basic needs met. And I think that we don't consider enough or loudly enough the fact that insufficient social structures allowing for people to flourish is just the normalization of social murder, where we're just refusing to acknowledge that, like, we have the resources to let people live happily, comfortably, and healthfully.
wish list would be stop using our tax dollars to kill people and like use it to help people instead.
Yes.
I think we need to expand what people feel is possible. I think there's just this feeling, oh, we're a small state, we can't have universal health care. Oh, we're just, you know, what are we going to do in Vermont about the genocide in Palestine? Oh, there's nothing we can do. When we have weapons manufacturers that are manufacturing weapons that are getting used in the genocide that is happening right here in our state.
Data centers.
The data center, right? I think a part of this movement is expanding what people feel is possible, because it is possible, right? Like if we stand together, we can tax the rich to fund universal health care. We can end weapons manufacturing in Vermont. We can do those things if everybody is standing together and united and demanding it. And I think that's a big part of what this project is.
And because Vermont is tiny, we're the perfect test case for all of this stuff.
Yes, and we're bigger than Iceland, which does have universal health care. So.
And as a reminder, so I think I have a pretty good comfortable sense that most of us go to either UVM or community health centers or both as patients, and to talk to others in our communities, because you know this is one group, but we're part of other community groups, that patients need to say this to the places that they are going to seek care, because on occasion, I can imagine management views us as just really loud, annoying employees. But when they hear it from their patients, when they start saying, hey, this is not okay, such as the third-party billing, that gets more noise. That gets more coverage and hearing from patients going, this is not okay, and we need to talk about universal health care, because I don't think that's a pie in the sky dream, right? It's such a weird idea that we all deserve health care. I mean, what's up with that, right?
And we're already paying the money. Vermont's the most expensive state to get health care. The money's already being spent, it's just not being used appropriately.
That's right.
Yeah.
I see there's two folks in the audience who've raised their hand, and I want to maybe invite the two of them and then come back. Okay, yeah, maybe we'll take all three. Actually, let's do two, and then we'll come to you next. That's okay, babe. Do you want to go, and then you could go next?
So I just want to say that I'm with the Community Health United as well. I'm a clinician there. The issue, one of the big drivers of these layoffs and the dismantling of the billing department was a company that is based in Florida. They use call centers in other parts of the world, taking over the jobs, taking over that whole process. People and billing at our agency has to help people navigate our programs and our assistance programs and our state's programs. They don't know anything about them. But the private equity takeover of healthcare is also a really big issue. That there's been hospitals and clinics around the country where entire medical staff is laid off, doctors are laid off, and they bring in private equity providers. So I want us to just start to be really aware of that. That is the driver of this. That is.
Oh yeah, and management has threatened us that if we don't get our books in order, private equity could just come in and buy up the whole thing.
Wow.
The support staff aren't the one making the financial decisions. Exactly. But we're the ones that they're trying these scare tactics on. A, I don't think the Green Mountain Care Board would stand for it. But B, private equity has no right to be anywhere near healthcare or housing. And it's time to put an end to that too.
I looked up the organization and it says it's not a private equity organization, it's owned by a private equity organization.
There's a shell over the shell in the shell game.
Yeah, thank you for that. Yeah.
Okay, my name is Minnie Wilkinson. I'm here in solidarity with you because my mom was a nurse at Kingston Field Hospital in New York with 1199. And when they had this kind of issue, we the patients, the kids of the workers, we shut it down.
Yeah.
And so, put me on the list. When you're ready to protest, I'm a patient at UVM.
It's amazing.
And so the patients got to now come out and tell them what we need, because they have it as a funnel. We need to turn the funnel upside down.
There it is.
Cut the top.
Yes.
UVM have too many administrators, directors, and BS holders.
so much, Winnie. That's great. Yeah, Becky, do you want to get in there?
Hi, my name is Becky Searle Schrader. I am a chief steward with UVMMC Support Staff United. I work overnight with provider access, which is also the main switchboard of the hospital. I'm actually in between two 12-hour overnight shifts right now. This is important to me. The work that we do in our union is so important to me. Right now in my department, they have started adding hospitals. So basically what we do, in a nutshell, we answer for close to 100 clinics in 3 different hospitals for answering service. We are the switchboard for 2 hospitals, and we run codes for UVMMC and a very complicated code for Porter. Porter was added to our switchboard 2 years ago, and we actually lost staff when they did that. They just added home health and hospice to us. It was supposed to be trialed this weekend, and there's massive phone issues, so they put it off. That is for very busy clinics that are being added to our roster. When I asked about staffing, I heard the term FTE neutral, meaning our staffing is going to stay neutral. They also told us that this fall they are going to be adding CBMC to our switchboard, followed by CVPH, which comes with Elizabethtown, Alice Hyde, and I think one other hospital. And we have not actually been told if we're even getting more staff for this. So at night, there are 2 people for 10 hours usually running codes, answering for 100 clinics. And it terrifies me because multiple times recently, we've had 3 emergencies happen at once, and there's only 2 of us. And I'm just like, what if that was your mom or your grandmother or your best friend or your kid that was the 3rd emergency? And we were promised like 2 years ago that we were gonna have 3 on nights. I have a great manager. She tried to do that, but it ended up basically the 3rd person just makes it so that we can get time off so we don't keep burning out. We also get calls at night for the answering service of patients who say, someone in the clinic told me that if I needed to speak to a provider, I should call at night because they have to answer. No shade to anybody working in any clinic. They are dealing with the same horrible situation that we are, but when they're telling people, you're not going to get paid attention unless you call at 2 o'clock in the morning and demand to speak to somebody because they have to talk to you then. Our system is so incredibly broken, and there are nights at work where I'm exhausted or just so scared because our equipment breaks down. The other night on my computer, the equipment that helps us run codes stopped working, which meant there was 1 computer in our office that could handle.
Say what a code is.
So as code operators, whenever you hear the voice from the sky saying code blue or calling out a security code, that is us.
So like somebody's having a heart attack.
Somebody's having a heart attack. We have to send a page out to coordinate 6 different staff members to have them all call in within 5 minutes. And if they don't, we have to start calling them and saying, hey, did you get this page? There are over 50 codes that we have to know and we have to run, from somebody's not breathing to an outpatient just needs to have medical attention and be brought to the ED, to chemical spills and chemo spills. We have a whole binder of them. And there's 2 people doing all of that for 10 hours a night. It is not safe, and it is burning us out. And then we can't do our jobs effectively. And there are departments all over the hospital that are sort of invisible like we are. Nutrition services, you can't have patients if you don't feed them. Environmental services, the hospital loves to write about their low infection rates. That starts with the people who go into a room and they clean that room to make sure that it does not have anything infectious left in it. Every single job in the hospital, except for possibly the ones at the top, are directly related to patient care. But yeah, in my department, it's bad. and it's getting worse.
So one of the things we'll ask you is if you hear folks talking about bargaining, we're fighting for you as much as we're fighting for us. We need livable wages so that we can live here and work. We need safe staffing so we know we're working at a hospital that's not actively harming people that come in through our doors in their times of need. And it's just wild the things that folks are being asked to do in the name of short-staffed.
Yeah, thank you for getting in there. I want to throw it to Theo, and then I actually want to invite Deirdre and Jessica and Chris, if any of you have any comments, and then I think we're going to move for some last comments from the panel. But maybe first get Theo in, and then we'll go from there.
Yeah, I just had a comment and 2 questions. I think the first comment was I really appreciated how you were all talking about safe staffing, health insurance for all, healthcare as human rights, and livable wages as all being intertwined and interconnected. I think I heard from many of you that if you can't recruit and retain, if you don't have enough FTEs, full-time employees designated from the hospital, you can't have safe staffing. So those issues are all very tightly intertwined. And so that was my comment. My first question is, there's been a lot of strike talk in the last month. And I'm thinking about how every strike, every union before 1935 was illegal in this country. And in 1934, there were 3 general strikes that produced labor law as we know it. We know that in the last 5 decades, the labor law has been gutted, starting with the Taft-Hartley Act, going back to the 1940s. I'm wondering 2 questions. One, what do you think is the role of strikes today in the healthcare movement? And 2, what would you say to a coworker who says, I have to cross the picket line, I have to take care of my patient?
Yeah, thanks, Theo. And I wonder if maybe we can open it up for Jessica, Deirdre, and Chris, and then if people can incorporate just thinking about strikes, what Theo was just putting out. But first, and you don't have to get in there. I just wanted to carve a space open in case any of the 3 of you want to get in there. Chris, maybe I'll throw it to Chris. Chris, do you have anything from across the lake you want to get in there with?
Yeah, I just kind of wanted to say, first, everybody still hear me? All right. Everything that you guys are talking about is happening on the other side. It's no different. It's the short staffing. It's again having to work more, having to stay late. Our medical office groups are being pounded right now, and are constantly being under pressure, and again are constantly having to work late. I've had managers sit across the table from me and tell me things, as I heard in this room already, that, well, if we could just get staff to come in, staffing wouldn't be an issue. Let's not say that, we're burning them out. We're putting people on a razor's edge between their livelihoods and, their license. We're dealing, at the end of the day, we're dealing with people. We're dealing with human beings. And we're constantly being told to treat them like cattle or like sheep. Get them in, get them out. Everybody's got to fit into a nice little box. If you fit outside that box, too bad, so sad, we've got more that got to come in so that we can make money. They're putting a dollar figure on our patients, and that is not acceptable in any way, shape, or form. They closed the Adirondack Blood Bank over in Plattsburgh. Been around for 50 years, and we basically have one area in this country that has no issue with receiving platelets or plasma. And if we do, we had a group of people and stuff that were hardcore donors that they could call on a dime's notice to go and give. They closed our center, said that the Red Cross was going to take over with it. But just last week, UVM and the Red Cross came out and said how dire their straits are and how they don't think they can get enough plasma and enough blood. We in Plattsburgh now are going to get blood from 2 places. That's going to be either, here in Burlington or in Albany. And that goes all the way to Malone and Alice Hyde. That goes all the way to Adirondack and Saranac Lake. We served all these communities. We no longer do. Our services have been stripped down to nothing and stuff. From Plattsburgh to Watertown, we have Watertown, for anybody that's not sure, is over on Lake Ontario. That's the entire North Country. We have a total of 10 PEDS beds in the North Country. You know where those 10 feed beds are? Watertown. That's what you have all the way across. And again, UVM continues to tell us that again, with the whole money, we have no money. Every time bargaining comes around or it's time for a new contract, suddenly there is no money to be had. And, while they're playing fast and loose and making all kinds of poor management decisions, and thinking they were the big, game in town, they were held accountable finally by the Green Mountain Board. And, don't let them fool anybody in here to thinking that, the Green Mountain Board know the way things are nowadays. This is the way it is. This is how we got to do it. No. You paid fast and loose, you got caught, and now you're being made to be accountable for it. And now we're the ones that are bearing the brunt because we are the ones in the front lines with the patients who are out there trying to do the best for our communities. So, again, understand that we are with you 100%. The one thing that, having this one big network is a good thing for is that all these unions, all these groups of people from every hospital, every facility can get together, can come together. And when we do that, that's a very powerful message, going across. And, being a part of all this is very good. And again, just know, whatever we can do, we will be there for you guys. And we're feeling the pain that you guys are too. So, as again, I want to thank everybody for having us on here and being a part of all this. Thank you.
Can I answer?
Try to answer Theo's. Theo, can you repeat your strike question? I already forgot what it was. I came off of a night shift last night, and I don't know.
The strike gives us the ability to force our employers to bargain in good faith. I'll bring it back to what Deirdre said. It took them 13 months to get a contract. They are not allowed to strike. They don't have that pressure to put on their management. Totally unacceptable. That needs to be redone in Montpelier as soon as possible, because that is our one bargaining chip to bring management to the table. It is the only thing they're afraid of is the stoppage of our labor.
That's right.
And then what would you say to somebody who's scared?
What would I say to someone who's scared to strike? So if that happens, if we do have a strike, they're obviously going to be bringing in replacement staff. It's my understanding they typically bring in more replacement staff because they're not going to provide the same quality of care. So the patients will get care. And the other thing is that, part of the strike threat is showing the hospital that we are serious.
That's right.
We need to see change, and this is the time for us to do it. We're, going to be having our contract expiring in, is it 2 weeks? A little over 2 weeks.
A 2-week extension.
We're bargaining for a 1-year contract. A lot of time contracts are 2 or 3 years, so we can't do this all the time. This is the time to do it, and we really need all of the staff to be on board. We have to try to support each other in however we can, whatever ways we can. And, this is just our time to do it. So we've got to be serious about it and show them that we need to see change now.
That if they have enough money to pay for workers to come in, they have enough money to pay the workers that are here now.
That's right.
Yeah, just we're gonna head into another contract fight this fall, so come out and support us too, everyone. But also I wanted to bring up Prop 3, which would amend the state of Vermont Constitution to enshrine the right to bargain, and that's gonna require an intense fight, an intense public campaign. And it's not just voting, but talking to your community members, people in your family members. Everyone needs to vote yes so that we can make sure where we do not become a right-to-work state. Like, we have the right to work.
Right to work for less.
That's right. So our plan is to wrap it up around 4:30. It is 4:30 now. I just want to see, are there any other burning things that people, like panelists in particular, wanted to get in there? An invitation for just a short, gotcha. Yeah, good. Yeah, hop in.
Go for it.
Come on the 28th. What's happening on the 28th? Our last scheduled bargaining session, yes, sorry, I forgot. I'm under a lot of stress lately, so our last scheduled bargaining session is on Tuesday the 28th from 5 5 to 8 in the McClure Lobby Conference Room at UVMMC. Come through, support us. There's a Zoom link. Party on the lawn. Party on the lawn. Party on the lawn. I don't remember anything. I've been so busy lately. But one thing that I just wanted to say was that we, as healthcare workers, end up having to think on more of a population level than an individual patient level when it comes to a lot of things. And if striking is the way that we can get more staff, that is going to have a positive effect on the population level of patients, even if there is, you know, a tick of an issue for a day or two for like a current set of patients. As someone who works in cancer, which is acute on chronic issues, having more people have more healthcare access means that more people who are getting cancer or going to get cancer will be diagnosed earlier and will require much less intensive medical intervention and much less intensive medical resources. So striking, getting more staffing, and more than anything, universal healthcare is going to alleviate all of the issues my workplace is facing, and then maybe I'll be able to go on my honeymoon without wondering who's going to die while I'm gone.
Anyone else at this table want to get in with a final thought? Lou, do you want?
So I was gonna hold up a CBA copy because I seem to be sleeping with one on my bedside table, and I have two in my bag because one was not enough, I guess. But I want to say that, you know, CHC brags that hospital workers come to CHC as patients, and our former CEO Jeff said when UVM started layoffs we were not. Well, I am here today, and that's super awkward. You know, our CBA does not allow strikes, and I often have been asked by employees this week really stressed out who are doing union stuff, like, oh my God, what does this mean for my job? And these are the individuals who have been impacted. Yeah. And I'm like, what's the worst that can happen right now? They're gonna fire you? We're already there. So I just try to reassure people, like, union activity is legal, and retaliation is a big no-no, big legal no-no. So thank you for inviting me here today.
And thank you all for coming.
I just want to say that you know, the fight for affordable housing, the fight for universal health care, the fight to protect our public schools, the fight for migrant justice, these are not separate fights. These are fights of working people demanding what they need, and an injury to one is an injury to all. And when we fight, we will never be defeated.
Do you want to say something, or are you good? Okay, awesome. So I just want to reiterate, this is a campaign. Oh yeah, so this is a campaign. We are not just here to listen to these panelists, we are all active participants. And so I just invite everyone to grab a lawn sign, number one, to sign the petition to support bargaining for the common good at UVM Medical Center. If you haven't done that already, you can get that in the back. If you have a crew, a union, a community organization, a faith congregation, please invite someone from one of the UVM Medical Center unions to come talk about what's happening at the hospital. And then the last is to sign up for Vermont May Day Strong. We are building this movement together, and we are on offense, you all. That's what is happening right here. That's what's putting out, is we are going on offense. Sorry?
Show up on the 28th.
And show up on the 28th, yes. Yeah. So a huge round of applause for everyone who's here today, for the endorsers, sponsors. Thank you everyone so much.
Thank you, Keith.
And thanks so much, Chris, for joining us. Yeah, it was really important to have you in the mix.
Thank you for everything.
Thank you.
I think one of the main reasons that I came down today to support these healthcare workers is because this is a very, very important issue. The work that they do is crucial to our community, We really have to think about the care that we receive, the care our loved ones receive, the care our neighbors receive, and we have to treat these workers fairly. We have to give them the resources that they need in order to take care of us. And that's what's lacking right now, and that is why these upcoming contract negotiations are so important to the community as a whole.
Yeah, I agree. I think that if this is an existential threat, not just here in Chittenden County or Vermont or New York. This is an existential threat in the country. The crisis of healthcare. Regular people simply just cannot afford healthcare, and then as we are seeing, even if you are getting healthcare, you're going into medical facilities that are exploiting their workers, and that's not how we receive the care that people deserve. So if we want patients to be treated with humanity and be treated how they are deserved, that requires the healthcare workers to be treated with dignity and given what they deserve.
I would also add, as the representative for the Central District in the city of Burlington, I have a lot of constituents who work for the medical center. They're being priced out. They're being priced out of Burlington, and this is an equity issue, up and down. We don't hear these facilities talking about their administrative cost, and that's a huge issue. They're not willing to look at that. And if there were to be a strike, they would bring in workers to cover their employees. And if you can pay to do that, you can certainly pay your employees. And that was brought up during the course of this meeting, and it's a very true fact. We have watched these hospitals, UVM Medical Center in particular, pay for travelers, pay through the nose for travelers before they would offer affordable wages that were competitive in order to maintain a stable staff and treat people well. And what we're seeing right now is it's scary. It's scary that people are being treated this way. Thank you.
Yeah, and as you were saying, all of these crises are connected. Even if UVM wanted to hire more people to get safe staffing, if they're not going to pay workers enough, or if housing is not affordable enough and all the other basic needs are not available to people, then none of these problems are going to be solved. It's all connected, and that's why we need to be organized as a community, as working people, to fight not just for safe staffing, not just for medical workers, but for everyone. And that's why we're here. Thank you.
Hi, my name's Mila Grant. I am City Councilor for Central District, which is Wards 2 and 3.
Merrick Broderick, Burlington City Councilor, Ward 8.